Hi and Assalamualaikum. My name is Nur Adlina from DEU3C. Today, I'm with my team members Fatih Nurul Ain and Siti Shafika. We are going to talk about case study 2, anatomy and physiology. So, for my part, I will explain 3 points, which is nervous system, endocrine system, and blood. The first point is nervous system. What is nervous system? Nervous system is divided into two, which is central nervous system and peripheral nervous system. Nervous system consists of nerve cell, which is neuron. Neuron carry information in the form of electrical signal called nerve impulse. So I will talk about resting potential and how an action potential is generated. Definition: resting membrane potential refer to difference in electrical signal inside and outside cell when the cell is not transmitting signals. In this state, inside of cell has a negative charge compared to the outside. So, the value, normally the resting membrane potential is around negative 70 millivolts, which means the inside of cell is 70 millivolt more negative than the outside. Reason of negative charge: this negative charge is caused by the difference in concentration of ions, such as sodium and potassium, inside and outside cells. The cell membrane simply allows more potassium ion, which are positively charged, to leave than sodium ions to enter, thus creating a negative charge inside the cells. So, let's break down step by step. The step 1 is resting state. When the cell is inactive, the membrane potential is negative, usually around negative 70 millivolts. Permeable channels such as sodium and potassium move in and out of the mostly closed. Step 2, triggering on action potential. When a stimulus causes the cell's membrane potential to rise to a certain level, especially channels in the membrane called voltage gate ion channels begin to open. Step 3, depolarization. When this channel open, sodium ion Na+ enter the cell because they are attracted to negative of the cell. This movement of sodium make the inside of cell more positive. So, with more sodium coming, more channel opens. This will cause a rapid increase in membrane potential. Step 4, peaking and deactivation. One observed amount of sodium enters, inside of cell become positive relative to outside, reverse the membrane charge. After that, the sodium channel close and prevent the entry of sodium. Step 5, repolarization. Now, potassium channels open, allowing potassium K+ ion to exit the cell. This release of potassium helps the cell to its negative membrane potential. Step 6, after hypolarization. After an action potential, the membrane becomes more negative, then is its resting state for a moment before returning to normal. It is called after hypolarization. And the last step, types of action potentials. In neurons, action potential depend on sodium channels and they occur very quickly within milliseconds. In muscle cells, such as in the heart, action potentials also involve calcium, which can last longer and help control muscle contraction. So, in nervous system, we have common disorder, disease, and injuries. So, I take 5 examples. So, first one is Alzheimer's disease. This disease leads to progressive memory loss, cognitive decline, and behavior change, often seen in older adults. Second is Parkinson's disease, progressive movement disorder due to loss of dopamine producing neurons in the brain, causing tremors, stiffness, and balance issue. The third, stroke, that we are familiar with the disease, a sudden interruption of blood flow to the brain due to blockage or bleeding, resulting in brain damage and functional impairments. The fourth is depression and anxiety disorder. Both often involve altered brain chemistry and are common, sometimes linked to genetic, biological, and environmental factors. And the last is spinal cord injury. Damage to the spinal cord that can lead to loss of function and sensation below to the level of the injury, often resulting in paralysis. So, for nervous system common disorder, disease, and injuries, they have two methods that can solve. The first one is imaging technologies that divide by two, which is functional MRI, and the second is ultrasound, Doppler ultrasound. Second one is electrophysiological test. It also divided by two, which is EEG, electroencephalogram, and EMG, electromyography. For imaging technologies, the first one is functional MRI, which is magnetic resonance imaging. So what is MRI? Measure brain activity by detecting change in blood flow used to study brain function, especially in areas related to language, memory, and motor skills. Second is ultrasound, Doppler ultrasound. So what is ultrasound? Ultrasound is used to assess blood flow in brain arteries, commonly applied in diagnosing carotid artery disease and predicting stroke risk. So for the last method is electrophysiological test. The first one is EEG, electroencephalogram. So what is EEG? Records electrical activity in the brain using electrodes placed on the scalp, commonly used for diagnosis epilepsy, sleep disorder, and encephalopathies. And the second is EMG, electromyography. It is measure electrical activity of muscle to evaluate muscle function and diagnose conditions like muscular dystrophy, ALS, and peripheral neuropathies. Let's talk about the second point. Second point is endocrine system. What is endocrine system? The glands and organs that make hormones and release them directly into the blood so they can travel to tissue and organs all over the body. The hormones released by the endocrine system control many important functions in the body, including growth and development, metabolism, and reproduction. So now I will talk about function of endocrine system using a sketch diagram. They have 8 parts in our body. The first one is hypothalamus. Function of hypothalamus is regulates hunger, thirst, sleep, and wakefulness. Second is thyroid glands. Regulates your energy and your metabolism. Third is pancreas. Pancreas produces enzymes that help to digest food, particular protein. Fourth is ovaries. Influence how your blood circulates determines your mental vigor and your sex drive. Fifth is pituitary gland. Control all other endocrine glands, influence growth, metabolism, and regeneration. Next is parathyroid. Secrete the hormone necessary for calcium absorption. Second last is thymus. Helps build resistance to disease. And the last is adrenal gland. Help regulate several bodily functions, including metabolism, blood pressure, and your body response to stress. So for endocrine system, it also have common disorder, disease, and injuries. So I take for example, the first one is diabetes. Diabetes occurs when the pancreas cannot produce enough of the hormone insulin. Symptoms of diabetes are feeling tired, hungry, or thirsty. The second one is grave. Overactive thyroid, which is the most common autoimmune disease among women aged 20 to 40. Symptoms in this are anxiety, irritability, racing heart, feeling hot, sweating, and nervous. The fourth is PCOS, polycystic ovarian syndrome, a common hormonal condition that affects up to 1 in 10 women in their reproductive years. A hormonal disorder in women leading to irregular periods, excess hair growth, and infertility. And the last is traumatic brain. When the head hits something hard or is hit repeatedly, or an object passes through the skull and enters the brain. Because of this injury are fall, vehicle accidents, violence such as gunshot wounds, child abuse, or breathing injuries from sport or during combat, such as explosions. So, to solve that common disorder, injuries, and disease for endocrine system, we have one method, which is laboratory test. Laboratory test divided by 3: blood test, urine test, and saliva test. The first one is blood test. Blood samples are used to measure hormone levels, including thyroid hormones, insulin, sex hormone, which is estrogen and testosterone, and growth hormone. The second is urine test, often used to evaluate adrenal function and to measure hormone metabolism. The 24-hour urine test, for instance, can assess cortisol levels for diagnose Cushing's syndrome. And the last is saliva test. Measure hormones like cortisol throughout the day, often used in adrenal function testing. So, for the last point in my part, I will talk about blood. What is blood? The fluid that circulates in the heart, arteries, capillaries, and veins of a vertebrate animal, carrying nourishment and oxygen to and bringing away waste products from all parts of the body. For blood, it have function and characteristic of blood cell. It have two functions. The first one is transportation. Transportation divided by 3. The first one is oxygen and carbon dioxide. Red blood cell carry oxygen from the lungs to body tissue and return carbon dioxide from the tissue to the lung for exhalation. The second is nutrients and waste. Blood transport nutrients from the digestive system to cell and remove waste product to the kidney, liver, and lungs for excretion. And the third is hormones and enzymes. Blood transport hormones and enzymes, which are chemical messengers and catalysts to target organ throughout the body. The second is protection. Protection divided by two. The first one is immunity. White blood cell and antibodies in blood help fight infection and foreign substance. And the second is clothing. Blood platelets or clothing factors work together to form cloth, preventing excess bleeding when blood vessels are damaged. Related diagnosis technologies or equipment for measure blood. We have one method which is laboratory equipment that divide by three. The first one is hematologist analyzer, second blood gas analyzer, and the third is centrifuge. The first one is hematology analyzer. What is hematology analyzer used? These are used to perform complete blood counts, erythrocyte sedimentation rates, which is ESRS, or coagulation tests. Electrical analysis involves passing a dilute solution of the blood through an aperture across which an electrical current is following. The second one is blood gas analyzer. Blood gas is measurement of how much oxygen and carbon dioxide is in your blood. It also determines the acidity pH of your blood. And the last is centrifuge. Centrifuge is a piece of equipment generally driven by an electrical motor. Some older models were spun by hand that puts an object in rotation around a fixed axis. Lighter objects will tend to move to the top. Centrifugation typically specifies the amount of acceleration to be applied to the sample.
Hi, I'm Fatin and I'm going to continue the presentation with question 4, which is cardiovascular system. Blood flows through the heart. As you can see in that picture, blood enters the right side of the heart from the body, low in oxygen. It flows from the right atrium to the right ventricle. The right ventricle pumps it to the lungs to pick up oxygen. Oxygen-rich blood returns to the left side of the heart. It flows from the left atrium to the left ventricle, and the left ventricle pumps it out through the aorta to the rest of the body. Next is cardiovascular disorders. First, coronary artery disease (CAD), narrowing or blockage of the coronary arteries leading to reduced blood flow to the heart. This can cause chest pain, angina, and increase the risk of heart attack. Second is hypertension or high blood pressure. Persistently high blood pressure that strains the heart and blood vessels, increasing the risk of heart attack, stroke, and other complications. Third is heart failure, when the heart can't pump blood effectively, leading to symptoms like fatigue, shortness of breath, and fluid build-up. Fourth is arrhythmia, abnormal heart rhythm which can be too fast, too slow, or irregular. Atrial fibrillation is a common type that increases stroke risk. Next is related diagnosis technologies or equipment. First is electrodiogram (ECG). Records the heart's electrical signals to detect arrhythmia, heart attacks, and other heart conditions. Second is angiography. Uses contrast dye and X-ray imaging to visualize blood vessels and detect blockage or narrowing in arteries. Third is blood pressure monitor. Measures blood pressure to detect hypertension, an important cardiovascular risk factor. Fourth is cardiac MRI. creates detailed images of the heart using magnetic fields, useful for diagnosing structural issues and heart muscle damage. And the last one is Holter monitor, a portable ECG worn in 24 to 28 hours to continuously monitor heart rhythm for irregular activities. So for question 5, which is respiratory system. Mechanisms of inhalation of exhalation of respiration. For inhalation or breathing in, the diaphragm is contracted. The diaphragm, a dome-shaped muscle at the bottom of the lungs, contracts and moves downward, expanding the chest cavity. The muscles between the ribs also contract, pulling the rib cage upward and outward, further expanding the chest cavity. As the chest cavity expands, the pressure inside the lungs drops below atmospheric pressure. Due to this pressure difference, air flows into the lungs through the nose or mouth, down the trachea and into the bronchi and alveoli, where gas exchange occurs. So for exhalation or breathing out, the diaphragm relaxes and moves upward, reducing the space in the chest cavity. The rib cage moves downward and inward as the intercostal muscles relax, further decreasing chest cavity volume. With reduced chest volume, the pressure inside the lungs becomes higher than atmospheric pressure. Air is pushed out of the lungs, moving out through the bronchi, trachea, and finally out of the nose or mouth. Next is common disorders and disease related to the respiratory system. First is asthma, a chronic condition that causes inflammation and narrowing of the airways, leading to symptoms like wheezing, coughing, and difficulty breathing. Second is chronic obstructive pulmonary disease, COPD, a group of lung disease, including emphysema and chronic bronchitis that cause breathing difficulties and airflow blockage, often due to smoking or long-term exposure to irritants. Third is pneumonia, an infection that inflames the air sacs in the lungs, which may fill with fluid or pus, causing cough, fever, and difficulty breathing. It can be caused by bacteria, virus, or fungi. Fourth is lung cancer, uncontrolled cell growth in lung tissue, often linked to smoking or exposure to pollutants. Symptoms include persistent cough, chest pain, and shortness of breath. Next is related diagnosis technologies or equipment. First is CT scan. Provides detailed cross-sectional images of the lungs, allowing for a more thorough examination to detect issues like tumors, infections, and lung damage. Second is pulse oximeter, a small device that clips onto the finger to measure oxygen saturation in the blood, indicating how well oxygen is being delivered to the body. Third is bronchoscopy, a procedure in which a thin tube with a camera is inserted into the airways to examine the lungs and collect tissue samples, useful for diagnosing infections, tumors, and inflammation. Next is question number 6, which is digestive system. Digestion process from mouth until anus. The digestive process starts in the mouth and ends at the anus and involves several organs and other components, which are first at mouth. Saliva moistens food and begins breaking down the carbohydrate. At esophagus, muscle contractions move food down to the stomach. At stomach, food is churned and mixed with digestive juice. At small intestine, nutrients are absorbed into the bloodstream. The pancreas and liver help by sending digestive juice and bile to the small intestine. At large intestine, water is removed from undigested matter and solid waste is formed. The large intestine is also known as the colon. At rectum, stores stood until a bowel movement occurs. The last one is at anus, the opening where to lift the body. Next is chemical digestion along the gastrointestinal tract. At mouth, salivary amylase starts breaking down starch into sugars. At stomach, pepsin digests proteins into smaller pieces in an acidic environment, and gastric lipase begins breaking down some fats. At small intestine, pancreatic enzymes like amylase for carbs, trypsin for proteins, and lipase for fats continue digestion. Bile from the liver help digest fat. Tiny enzymes in the intestine finalize digestion of carbs and proteins into sugar and amino acids. At large intestine, some bacteria help break down leftover materials and absorb water and nutrients. So for the last question are related diagnosis technologies or equipment. First, endoscopy. A thin tube with a camera goes down your throat to check the inside of your stomach and small intestine. Second is colonoscopy. A similar tool with a camera goes into your colon, large intestine, through the rectum to look for issues like polyps or inflammation. Third is ultrasound. A device uses sound waves to make images of organs like the liver and gallbladder, helping find things like blockage or stones. And last one is MRI. A machine uses magnets and radio waves to take detailed image of soft tissues like the liver and intestines for finding issues like growth or blockage.
Hello, I'm Siti Shafika and I will continue the presentation of the other two topics, which is urinary system and reproductive system. So, let's start with the first topic, urinary system. The function of urinary system is to remove waste product from our blood as it passes through of our each kidney. So now, let's dive deeper to urine formation. This process involves three major processes: glomerular filtration, tubular reabsorption, and tubular secretion. Urine formation begins with glomerular filtration, which is water and solutes smaller than proteins are forced through the capillary walls and pores of the glomerular capsule into the renal tubule. Next, tubular reabsorption, where water, glucose, amino acids, and needed ions are transported out of the filtrate into the tubule cells and then enter the capillary blood. Lastly, tubular secretion. H+, K+, creatinine, and drugs are removed from the peritubular blood and secreted by the tubule cells into the filtrate. Here are the related diagnosis technologies or equipment. We have urinalysis, renal ultrasound, CT scan or MRI, cystoscopy, and kidney biopsy. Urinalysis. Use test strip to check for various substances in urine like proteins, glucose, and nitrates, and helping detect infection or kidney disorder. Next, renal ultrasound. Use ultrasound waves to access the kidney structure and detect stones or tumors. CT scan and MRI provides three-dimensional image of the kidneys and urinary tract for more detailed diagnosis. Other than that, cystoscopy. It involves a small camera inserted into the bladder to examine structural issues or tumors. And lastly, kidney biopsy. It takes a small tissue sample from the kidney for microscopic examination to diagnose specific kidney disease. Lastly, reproductive system. The reproductive system is a group of organs responsible for producing offspring and ensuring the survival of a species. In humans, there are two types, which is the male and the female reproductive system. So now, let's have a look on the female reproductive system hormones. There are two types of hormones, estrogen and progesterone. Estrogen helps develop and maintain female sex characteristics. Estrogen regulates the menstrual cycle. It also prepares the uterus for pregnancy. Estrogen stimulates the growth of the uterine lining. It helps with the development of eggs in the ovaries. Estrogen also supports breast development for milk production. Next, progesterone. Progesterone prepares the uterus for pregnancy by thickening the uterine lining, allowing for embryo implantation. It helps maintain the early stage of pregnancy and regulates the menstrual cycle. Progesterone also supports the development of breast tissue for milk production. Additionally, it prevents the release of new eggs during pregnancy to focus the body's resources on nurturing the growing fetus. Next, male reproductive system hormone. Testosterone. Testosterone is essential for the development of male sex characteristics and play a key role in the reproductive system. It stimulates sperm production in the testes and supports the growth of male reproductive organs. During puberty, testosterone helps deepen the voice and contributes the muscle and bone strength, which are important for overall reproductive health. Additionally, testosterone increases sex drive and libido, supporting reproductive functions. Do you know what is placenta role in pregnancy? So, the placenta plays a vital role in pregnancy by facilitating nutrient and gas exchange between the mother and fetus, allowing oxygen and nutrients to pass to the fetus while removing waste products. It produces essential hormones like HCG, progesterone, and estrogen to support pregnancy. Additionally, the placenta provides immune protection by shielding the fetus from mother's immune system to prevent rejection. It also acts as a barrier, blocking certain harmful substances while letting antibodies through, and helps regulate flight and electrolyte balance for both mother and fetus. Here are the diagnostic technologies or equipment. Ultrasound, used to visualize the fetus, monitor growth and development, and check the position of the placenta. Amniocentesis, a needle-based procedure used to collect amniotic fluid for genetic and health testing of the fetus. Fetal heart monitors, monitors fetal heart rate and rhythm, typically used during labor and delivery. Blood tests, measure hormone levels like HCG to monitor pregnancy health. Hysteroscopy and laparoscopy, procedures used to diagnose and treat reproductive organ issues in females. Semen analysis, used in males to evaluate sperm count, shape, and motility for fertility assessment. That's all from us. Thank you.